Welcome to the Holistic Plastic Surgery Show, where we dive deep into the hottest trends in health, beauty, and cosmetic treatments. I'm Dr. Anthony Youn, America's holistic plastic surgeon. Well, did you know that upwards of 70% or more of the risk of autoimmune disease, mental health issues, cancer, and in fact, most chronic diseases is determined by diet, toxin exposure, and activity level? And because of this, dramatically changing your diet and your exposure to environmental toxins can create incredible improvements in chronic diseases. Well, my next guest is what many doctors would call a medical miracle. Years ago, she was diagnosed with progressive multiple sclerosis, which left her wheelchair bound and quickly on her way to an early death. However, after determining how to maximize the delivery of nutrients and energy to her brain cells, she was able to not only halt the progression of her disease, but reverse it. She went from being confined to a wheelchair to completing an 18-mile bicycle tour. And she did this without medications. She reversed her multiple sclerosis using the power of food. Well, if you have someone in your life who is suffering from autoimmune disease, and conventional medications and conventional medicine are failing him or her, then you must see or hear this show. So let's get started. My guest this week is a clinical professor of medicine at the University of Iowa. She conducts clinical trials that test the effect of nutrition and lifestyle interventions to treat MS and other progressive health problems. My guest restored her health using a diet and lifestyle program she designed specifically for her brain and now pedals her bike to work each day. She is the author of the Wallace Protocol, How I Beat Progressive MS Using Paleo Principles and Functional Medicine. She is the author of the paperback, The Wallace Protocol, a radical new way to treat all chronic autoimmune conditions using paleo principles. And she's the author of the new book, the new cookbook, The Wallace Protocol Cooking for Life, a revolutionary modern paleo plan to treat all chronic autoimmune conditions. She hosts the Wallace Protocol Seminar every August, where anyone can learn how to implement the protocol with ease and success. I'd like to welcome Dr. Terry Wahls to the Holistic Plastic Surgery Show. Thank you so much for coming on the show, Dr. Wahls. It's definitely my privilege to have you on, and I think we've got a lot of very interesting things to talk about today.
Well, thank you for having me. I'm always glad to talk.
Well, I read your book and the Wallace Protocol. I read this probably about 6 months ago, even before I had thought about having you on my podcast. And now you've got a new book out, and so I'm glad that we touched base. What I'd like to do, just because most of my audience probably, they don't know where you're coming from, the types of people that you treat.
Sure.
If you can just start by telling us your story, because your story is definitely one that needs to get out there, that people need to hear about.
You know, I'm an academic internal medicine doc. And so I had a lot of bias thinking that complementary alternative medicine was a waste of money. But God works in mysterious ways. In 2000, I was diagnosed with relapsing remitting multiple sclerosis. And wanting to get my disease treated aggressively, I sought out the best research center I could find here in the Midwest, and that was the Cleveland Clinic. You know, I saw their best people, took the newest drugs, and continued to decline. Within 3 years, I needed a to-recline wheelchair. I took chemotherapy. I took Tysabri, one of those new biologic drugs that cost me about $50,000 a year, and continued to decline. Then I switched to CellCept. Now, I'll back up just a moment in that in 2002, 2 years after I was diagnosed, my Cleveland Clinic doctors had mentioned the work of Loren Cordain. I read his book, his many papers. And so after 20 years of being a vegetarian, I gave up eating grains, legumes, and dairy and started eating meat again, but continued to decline. So the next year I needed the wheelchair, took chemo, and then took Tysabri. So all in all, I had 7 years of steady decline. Once it hit the wheelchair, I saw that the best conventional medicine wasn't stopping my march towards being bedridden and quite possibly demented. And so that's why I started reading the basic science myself, and I read about shrinking models, models of shrinking brain diseases, Parkinson's, Lou Gehrig's, Huntington's disease. Saw that mitochondria was involved, and then started researching what were the things I could do to support my mitochondria with various vitamins and supplements. And after about 6 months of that, I decided I was wasting my money because I didn't seem to be getting better. So I stopped everything, and I just couldn't function at all. 3 days later, I went back on my vitamins and supplements, got up and went back to work. And so it became apparent that my supplements were doing something. They weren't recovering me, but clearly life was easier when I took my supplement cocktail. So I'm still declining, albeit more slowly. By the summer of 2007, I can't sit up in a regular chair like this. I have a recliner that lets me put my knees higher than my nose. I have one at my office and another one at home. I struggle to walk 10 feet using 2 walking sticks. I have severe fatigue. I have trigeminal neuralgia type pains that are horrific, and they come and go, and it's getting harder and harder to control that. And I'm beginning to have some brain fog.
So during this time, what were your neurologists, what were your physicians telling you? And you said, hey, obviously I'm going downhill. This is not acceptable. This is not where I want to go with the rest of my life. What did they
the
tell
news
you?
is not good. It's like you have progressive MS. So we're trying to slow things as best we can. And so I was still on a disease-modifying drug. But the response is, there really is nothing else that's approved for progressive MS, and you've already tried this stuff.
Did they ever ask you about diet? About
Never.
What you ate? Never. Okay.
Never.
Wow. Okay.
Never. Even when I was a vegetarian.
Yeah.
They never asked about B12. I hope they checked it. I mean, I don't know. And so in that summer, interestingly enough, my chief of staff called me and said, we're going to assign you to the traumatic brain injury clinic in January. You'll be seeing patients directly, no residents. And at that time, I'd been doing work for the Institutional Review Board, and I was staffing resident clinics. And the VA and university had been modifying my job multiple times so I could keep working as I was getting more and more disabled. And I saw this as the VA's way of saying, we're done modifying your job and sort of forcing my hand to, you're going to have to take medical retirement.
Yeah.
So I was pretty bummed.
To put it lightly, I'm sure.
Yeah, but as I said, God works in mysterious ways, because the next month I read Dr. Shields' protocol that used electrical stimulation of muscles, and I read that, thought, well, maybe could that help MS? There were 212 articles in PubMed. I read them all. Most of them were about athletes. There were a few about Parkinson's, and a few about, cerebral palsy and stroke. I convinced my physical therapist to let me have some test sessions, and after a couple of weeks, he let me do this at home. And at that point, I was so weak I could do zap my stomach and I'd crunch my belly while I was zapping. And so that was the extent of my workouts.
Wow.
At the same time, in August, I discovered the Institute for Functional Medicine, and I took their course on neuroprotection, had a longer list of vitamins and supplements, which I added. Still not a lot was happening, maybe just a slight improvement. And then I had a really big aha moment. What if I take my long list of supplements and I research again where they are in the food supply? So, that takes more time. I do that, redesign my diet, emphasizing these food groups that I now call basically the Wahls diet. And that's when the magic happens. A month later, it's January. I'm starting this new clinic, and it turns out I can do the work. And I'm not completely exhausted. Then the following month, I begin walking with a cane. And at 6 months, I'm walking without a cane. At 9 months, I do a bike ride around the block. I'm crying. My wife's crying. My kids are crying. Because this is when we all realize that we don't know what's going to happen. The paradigm that progressive MS goes only one way, downhill, is clearly wrong, because I am getting better. I am getting stronger. At 12 months, I do a 18-mile bike ride with my family. And so this really transforms how I think about disease, how I think about health. It would transform the way I practice medicine in the traumatic brain injury clinic. in my primary care clinic, and then it would ultimately transform the kind of research that I do.
Yeah, I mean, so your story is fascinating in that here's a person who is a physician who's in, I mean, at Cleveland Clinic of all places, you know, I mean, really the epicenter in the Midwest, and I'm in Detroit, of, you know, medicine, and you're having this progressive decline. Medicine, obviously, the conventional medicine doesn't have anything else to offer you except, hey, let's up your medications, let's give you more medications. Now, you really focus then on the mitochondria, and that's really the basis of all of this, is because that's, you know, the energy center of our cells, and trying to fuel that mitochondria to get the energy that you need, really, to your brain, to your nervous system. Can you explain that to our listeners and our viewers today? Just, you know, how you came about that idea, and you know, how you came about from, okay, let's focus on mitochondria, and how you jump from that to the foods that you eat.
Yeah, so we'll talk a little bit about mitochondria. Mitochondria, about 1.5 billion years ago, everything was just one cell size, basically bacteria. We'd had development of photosynthesis, so this oxygen crisis had led to the death of about 95% of all life forms. But there was a mutation that occurred that allowed one set of bacteria to utilize oxygen more effectively to generate energy, or ATP. They were engulfed by larger bacteria, and this cooperative relationship developed, which would then evolve into animals, which of course would eventually evolve into humans. All of our cells have mitochondria at the core of how we handle energy. And the cells that need the most energy, brain, retina, and heart, have like tens of thousands of mitochondria per cell. If the mitochondria strain not doing a good job in the brain, it'll tell the brain to not do the work that's assigned to that brain cell, or it will tell the brain cell to die. Neither one of those outcomes are very good.
No.
And you know, at the time that I was reading this stuff in 2004, 2005, this was in neurodegeneration literature, Parkinson's, Alzheimer's, Huntington's being the 3 disease states, and ALS, the disease states that I was reading most. Nobody was talking about mitochondria and MS. But in all these disease states, the brain was shrinking, and there's evidence for early death of brain cells. So I thought, well, this is something to try. And so my initial search was all about the vitamins and supplements. You know, and then I began slowly to expand my thinking into what's the research for what the nutrients are that brain cells need. So I went to mitochondria and brain cells, and with my functional medicine training, developed a longer list of vitamins and supplements supporting cellular health. And then, you know, the big aha was I should get this stuff from the food, because if I spend more time on food, I'm going to get the ratios of nutrients correct. You know, for example, zinc. Zinc is really, really important for a couple hundred enzymes. It's cofactors for enzymes in our brain. And so you might think, okay, I got to take some extra zinc, so I'll take 50 milligrams of zinc every day. And initially, I can tell it does really good things for me. But zinc and copper both get into the cells through the same receptor. So eventually, this extra zinc will lead to copper deficiency. Well, my cells, including my brain cells, need copper to function optimally. So eventually, when you get the ratios out of place, you begin to create other health problems. So having a much greater emphasis on food and a much more targeted emphasis on supplements is really a much more effective strategy.
And then how does this, you know, so you're looking at trying to get your brain, your cells basically, your mitochondria, the energy that it needs in the proper form through the right foods. How does this then bring you to figuring out that the modified paleo diet that you recommend is
the way to go?
Yeah, exactly. You know, I mean, because we all know there's so many other diets out there, and there are, you know, physicians who are very well read, very well researched that advocate them. Why is it that you think that for your approach that this modified paleo diet is, no question, has been the way to go for you?
First, I think the way I interpreted my vegetarian diet probably led to inadequate B12, probably mineral deficiencies, and overgrowth of yeast. So my interpretation was not so good. There may be other interpretations that can be more helpful. And I think the scientific rationale for the harms of grains with the lectins and the phytates, particularly the genetically susceptible, will create problems. And if you have a chronic brain problem, you're much more likely to have the genes that put you at risk to have an adverse response to phytates and lectins, two big components in grains. Now, what I did that is probably different than most paleo diet advocates is I went out using the basic science and using the scientific literature and peer-reviewed journals to say, okay, so what are the vitamins, minerals, fats, antioxidants, proteins that my brain cells, my mitochondria need? And then I said, how do I eat a diet that provides all that? Now, and I did it within the construct of the paleo diet because of my interpretation of the literature. And then, so I designed it very intentionally. And then because I also do clinical research, I tested it. So we created menus, created recipes, fed it, did 24-hour recalls, and then did a nutrient analysis. And I sort of tweaked the rules to make sure that when you follow my rules, the vast majority of time, your brain's going to get all those things that I say in my book you should have. You know, and really, if you I don't think there's any other physician author out there that has advocated for a diet and then actually tested it to say, and it actually delivers the stuff that I say you're supposed to have.
Yeah, no question. Now, your new book, The Wallace Protocol, Cooking for Life, the Revolutionary Modern Paleo Plan to Treat All Chronic Autoimmune Conditions. By the time this podcast comes out, it will be on sale, so definitely encourage you, the listeners and the viewers, to take a look at that. And really, now the interesting thing here too is, you know, you focus a lot obviously on MS because that was what your affliction is, and that's what you have the personal experience of treating. How has the Wahls protocol, the protocol that you have developed, also affect people who have other autoimmune conditions? Because obviously there's so many out there. How have you found in your patients that you've treated, how have they done? And have you modified it from people who have MS maybe having a certain protocol to people having other autoimmune conditions?
So for years I practiced at the VA in my traumatic brain injury clinic. This does great recovering traumatic brain injury and mental health stuff. Because of that success, the VA ultimately said, would you create a clinic focused on just your approach? And we called it the Therapeutic Lifestyle Clinic. I ran that for 3.5 years. And we took anyone with a medical problem, mental health problem, neurologic problem, who was willing to do diet and lifestyle. And so we had a lot of folks with chronic pain, many folks with a wide variety of autoimmune conditions, MS, of course. But we also had things like rheumatoid arthritis, lupus, psoriasis, eczema, asthma. And what we saw was people who would implement the protocol typically had blood pressure normalized, blood sugars normalized, pain scores go down, their need for pain medication steadily declined, their autoimmune disease quieted. Many folks were able to reduce or even eliminate their disease-modifying drugs. And then we did learn over time that you had to be very careful with their patients to explain that if you get great success following the diet and lifestyle program, this is potent disease-modifying therapy. So if you have cheat days, it's like stopping your Humira. It's your disease will again flare. So we're much more careful to say, if you get a great response, that means that as long as you follow the protocol, you'll do extremely well. But if you cheat, expect that you may suffer from a disease flare. So
you've had people who've had, let's say, rheumatoid arthritis, people who are on lupus, even people who are on immune-enhancing medications. Have you found that they have, by changing their diet, by changing their lifestyle, been able to actually get off those medications, or at least
they can. I make it in our practice. We were very clear that we wanted to have 6 months of excellent response, and then we would work with the prescribing physician to take them off their medication and watch closely. We'd also identify what were the factors that would make them want to go back on their disease-modifying drugs, and we would stress to our patients, if you cheat in the future, expect a flare. We used to think that they would realize you can't ever cheat. Now we have to be much more explicit.
Now, one of the things, for your protocol, and initially when people hear this, they may say, what? Because it is a difficult thing to do for some people. But the first thing is to eat 9 cups of fruits and vegetables a day.
Yeah.
And it's a lot.
That's a lot.
It is a lot. Now, for somebody like myself who is, healthy, it's not, I don't have any autoimmune disease. I think of it, I go, wow, that's a lot. But I'm sure you have patients who say, look, I'm on 4 different medications, and medications make me feel terrible. I've got these side effects. Do you find that people tend to follow? I mean, how well do they do following this protocol when you do ask for it? It's a lot you ask for.
We ask a lot. We never argue with our patients. So when people come to the lifestyle clinic, they would get an intro class, hear my story, hear the functional medicine, and then we invite them to either to say, well, this is too hard, I can't do the protocol. Mm-hmm. I'd sort of like to ease into it, so I'll work individually with the dietitian, and I'll gradually improve my diet. Or I'm excited, I'm ready for the possibility, I will do this as an experiment 100% for 100 days and see how good I could be. And so we invite people, and either they are ready for action, they're contemplative, so they'll work individually with a nutritionist and gradually make change, or say, nope, this is not the right time in my life. And when we work with people, say it's 100%, and they understand the rationale, and we've go through a half day where they spend a couple hours with me, and we go through all the environmental factors that contributed to their health decline, and so they can see why the diet is so helpful, why the interventions are so helpful. Then they're willing to go through what's a pretty uncomfortable initial 2 weeks where you go through withdrawal, you're sort of cranky, you have more headaches, but we help people through that. And then as symptoms reduce, it's usually pretty easy to stay on the program.
So have you had other patients like yourself who are on this steady and even sometimes rapid decline, progressive decline with MS, where they have become wheelchair bound, and you have gotten them back?
Gotten them back, yeah.
To just like you do, you ride your bike to work every day, which is...
Yeah, I'm really very excited. So we have a lot of papers coming out.
Yeah.
We have a paper that'll be coming out talking about the great changes we saw in mood and cognition in the first group. There's a paper that we're revising that has the videos of the before and after, including some really very, very, very exciting changes. Yeah. And I'm putting that in an open access journal. So I'm hopeful that will be released soon. And if that's the case, then people will be able to see those amazing videos too.
So an open access journal, for those people who are listening and watching today, basically, the traditionally scientific journals are basically made for physicians, and they're published and they're sent to anywhere from 1,000 to maybe 10,000 or 20,000 physicians, and the public doesn't truly have a lot of access to that. You may be able to get an abstract, which is a very condensed, 1 or 2 paragraph version of the article, but otherwise you have to technically purchase it, which can be quite expensive. And so open access journals are a relatively new way for physicians and now patients to actually get information very quickly. Dr. Wahls and I both know that if we write a paper, a research paper, and submit it to one of our journals, it literally can take a year for that paper to actually publish, an entire year turnaround. And during that time, especially in work it's so important like yours, where you've got patients who are rapidly declining, to wait a year to get that information out just isn't acceptable necessarily. And so that's what the interesting part of the open access journals now is, that with the availability of the internet and high speed information exchange, people can actually read this paper fairly quickly, which is very important.
Yeah, we've made the decision to get our journals to choose open access journals to make the information more readily available to the public. Because I know many physicians, they've heard about the Wahls diet, the Wahls protocol from their patients, and they've not seen much about it in the literature, and they want to poo-poo it. So if we can give patients links to the actual papers, they can print out the papers, take it to their primary care doc and say, I want to try this diet. What's the harm? What do you need to monitor? It just makes it so much easier for the patient and that primary care physician.
So just really briefly, with the diet part of the Wallace Protocol, obviously the first big step is the 9 cups of fruits and vegetables each day. You also do recommend that people avoid certain types of foods, processed foods, sugar, the
grain,
gluten, the dairy. Do you think that it's more the phytonutrients that they're getting through these fruits and vegetables, or do you think it's how much of it do you think is that versus actually removing the toxins and the bad foods and decreasing inflammation?
This is a great question because it's answered in my next paper that's coming out. It'll be coming out in the Journal of American College of Nutrition. We did an association between various components of the intervention that people were adhering to. The recommended fruits and vegetables, avoiding the excluded foods, doing the exercises, doing the meditation, doing the E-stim. And the most powerful one was the fruits and vegetables. Also very, very powerful was avoiding the excluded foods. It was helpful to do the stress reduction, the exercise, and the E-stim, but the food, hands down, is the most powerful. I think it's pretty important to do both, and I actually expected the exclusion to be the most important, and then the vegetables to be just under that. It's flipped the other way around.
Interesting. Do you think it's mostly due to the phytonutrients, or do you think it's more the things that we know about, the vitamin B, the vitamin C, the vitamin K, and all that stuff? Or is it the underlying phytonutrients maybe we don't know about yet?
I think we're changing gene expression with all those phytonutrients. I think we're feeding the microbiome with all of that fiber that's in those 9 cups of vegetables. And then by adding more micronutrients, we're addressing the triage theory that Bruce Ames talks about. If you don't have quite enough vitamin K, I'm going to clot my blood so I don't bleed to death if I get cut, but I won't take care of the blood vessel health and heart valve health and my brain health that will kill me in 20 years because I have to make sure I don't die tomorrow.
Yeah. Well, I've got a quote I'd love to hear. One of the things I think that is really important and you really are focusing on, and I think, I admire how you are taking a stand really for functional medicine and the benefits of it. And your story, I think, is such a key one, I think. And in 10, 20 years from now, people will be talking about your story being one, that I think that really will change a paradigm of medicine. One thing that you wrote in your book is the problem with the conventional focus on drugs is that study after study has shown that diet, toxin exposure, and activity level account for 70 to 95% of the risk of autoimmune disease, mental health issues, cancer, and, in fact, most chronic diseases. Drugs do not improve the quality of your diet. They do not reduce your toxin exposure, and they often increase it. And they certainly don't increase your activity level. Rarely will they help lower the chronic stress that you feel in your life. And this paragraph really, to me, tells me so much really about the whole functional approach to medicine. So I think it's so important, and as an allopathically trained physician myself, I did 3 years of general surgery residency where I spent time in the ICU and in trauma. I did 2 years of plastic surgery. I did a fellowship. And honestly, I was not aware of functional medicine until just the last maybe 2 years. It just wasn't something that we talked about or was taught in medical school. We didn't have a nutrition class. And I went to Michigan State College of Human Medicine. It's actually a very progressive medical school, yet still no nutrition. Can you explain the different perspective on, especially in your situation where we're talking about autoimmune diseases, the traditional medicine perspective and the difference between that and the functional medicine perspective? Because I think this is a super important perspective that really needs to get out there and the public needs to learn about.
Sure. So for autoimmunity, we all agree there's something about the immune cells that have gotten confused, and they will attack healthy structures in that person's body. In my case, it was my brain and spinal cord. And why is that? Well, I'd ask my conventional doc and say, well, we don't really know. You probably had an infection sometime earlier, and that has triggered this immune response. We don't know why it sometimes gets worse and why it gets quiet, and we just don't know. The only thing we can do is give you, and because I picked the drug, to try and block your immune cells so they can't be quite as vigorous.
Yeah.
Now, the downside of that approach is that we need our immune cells to maintain and repair normal aging of our bodies. As we got a more sophisticated understanding of our immune cells, we've gotten more and more powerful drugs that can block things. So now we have drugs costing anywhere from $50,000 to $100,000 that can turn off my immune cells so effectively that instead of having a 30% risk of new lesions every year, it can be reduced by 60%. So it is very effective at reducing disease activity. But again, because it doesn't address the fact that we need our immune cells to maintain, repair our cells, all these very, very potent drugs, while they control symptoms, create a host of other symptoms because they're interfering with a very vital part of a healthy, normal body. The functional medicine standpoint is I'm going to use all the basic science papers to understand what are all these environmental factors, how diet, how lifestyle, how environmental exposures, how the microbiome, how hormonal balance, how social networks, all these factors interact with my unique DNA to impact how my organs work that created this sickly, disease-prone body that led to whether it might be depression, anxiety, chronic heartburn, autoimmune problems. And of course, if we don't address these root factors, and I just use drugs to control whatever disease symptoms I have, these disordered environmental factors will keep wrecking how my cells run the chemistry of life. More symptoms will develop, more disease states will develop. I'll be taking more drugs, and then I'll start having greater impairment of function. I'll start having more disabilities. I'll soon not be able to work. I will soon need nursing care from family, friends, and then from professionals, and then I'll need nursing home care. The only way to get off that train is to get into the dirt. What is the root cause?
Exactly.
All these environmental factors that are interacting with my DNA. Now, when I was working at the VA, I couldn't do fancy functional medicine testing. I couldn't do fancy functional medicine supplements. All I could do is take a very good history, teach people how all these environmental factors were interacting with their DNA, and then all we could do is we could fix all those environmental factors, diet and lifestyle. And I had really phenomenal success. So it was actually, at the time, it was a little bit annoying that I couldn't do all my functional medicine testing, but it turned out to be a just tremendous gift because it made me more effective as a teacher, as someone taking the history, and to realize that if all we do is teach people how to address diet and lifestyle, that is where all the money's at. That's where healing occurs. Yeah.
Unfortunately, the problem I think in traditional medicine and in the healthcare industry today is that there is no money in doing that. That's the problem. And so there's no incentive for pharmaceutical companies to research how the food that you eat is going to improve disease states. It makes a lot of money for them to make a medication that will reduce the symptom and that they can sell, but not necessarily to, hey, let's do a study on how changing your diet can impact your MS. And that's where you are working on a study, my understanding, right now with the University of Iowa. Can you tell us about this? Because it is an interesting study because it's not just your diet that is being used in this, but a very different diet as well. So
actually, I'm really very excited about this. I think it was the buzz around my book that created a huge awareness in the multiple sclerosis community about the power of diet and lifestyle, which then created desire on the part of the MS Society to make diet and lifestyle research a research priority. They put out a call for studies. We submitted a proposal. And because I'd been doing this work for several years with our little pilot studies, we had come to realize that patients did not want to be in a study where they could be randomized to a control group. If they're going to do the hard work of changing diet and lifestyle, they wanted to have an intervention. And we knew that the MS community really wanted to see a comparison of the Swank diet and the Wahls diet. So that's what we wrote. And so we have a observation period where nobody gets the study diet. So we just observe people 12 weeks. Then we ask them to follow the standard American diet. And then we randomize them into either a low saturated fat diet, the Swank diet, or the Wahls diet. So we've got about 24 people in the study so far. We're trying to get to 100. And it's exciting. It's lots of fun to see how things are shaping up.
Yeah, and I mean, I'm assuming that we'll see, I assume that we'll probably see some overlap, with success between the two because,
correct.
Even though, let's say the Swank diet is low saturated fat, they're still recommending, a lot of the same things that you do with the fresh fruits and vegetables.
Well, actually it's very interesting. Swank in his book said almost nothing about vegetables.
Oh, really?
Said almost nothing about sugar and white flour. He's focused solely on getting the fat out.
Oh, is it? Okay.
Now, the Swank Foundation, after my book came out, modified their recommendations to include getting more vegetables in.
Okay. Yeah.
So, and rather than study the original Swank diet, we're studying the Swank, slightly modified by the Swank organization to my diet. So I do think the Swank diet will be have some benefit. I think the Wahls diet will have greater benefit. That's why we have an observation period, so we can compare back to the observation period as well as across the two diets.
Well, that's exciting too, that this type of research that really there's no money that can be made from it. It literally is just taking the time to discuss and give patients information that they can use themselves, that research is still getting funding and is going out there. So for those people who are watching and listening today, and let's say they may have an autoimmune disease or they have a family member that does, just to simplify things for them as a place to get started, if you could give 2 or 3 things
real
that they might be able to do, just to kind of get started before, let's say, they dive deep into your book, what would those 2 or 3 things be?
Step 1, get rid of the excluded foods. So sugar, gluten, grain in particular, and I'd also take away dairy protein because they cross reactivity. And then I'd begin ramping up the vegetables. And that's a great way to start. I'd, of course, encourage them to read my book because you can really understand the why. Because it's hard to sustain things if you don't understand the why really well.
Yeah, so the idea is the idea of nutrigenomics, where people may say, I think one of the things as a physician that we hear patients and even physicians use as a crutch is, well, it's genetics. This is happening to you because your parents gave it to you. And the only thing we can do is we can treat it with medications. But the interesting thing about nutrigenomics is this prevailing idea that, yes, we all, we're given the DNA, we're given the genes that our parents give us, but the things that we do can control and can, really can control how our genes express themselves. And so if, let's say, you do have a genetic tendency for an autoimmune type of a condition, if you have a certain diet, if you have a certain lifestyle, if you avoid certain behaviors and certain exposures like you do, you can actually cause your genes then to manifest differently than in somebody who says, hey, you know what, I'm going to be drinking a ton of alcohol, I'm going to eat a ton of processed foods, a bunch of sugar. Now that disease process goes in a different direction. And that's something I think that we're going to be learning more and more about it, as the years progress, because there seems to be so much truth to it.
Absolutely. Right now, I believe there are about 300 genes that increase your risk for MS ever so slightly. For most of those genes, the increased risk is about 1%. The vast, vast majority of people with that particular gene will never get MS. And what people hopefully will continue to appreciate is the food you and I eat turn genes on and off. And so you eat all that kale, eat all of those beets and carrots and a few berries now and then, you'll turn on health-promoting genes and turn off disease-promoting genes. You'll live longer, look younger, and have a better love life.
Well, thank you. So if you're interested in learning more about Dr. Wahls, go to her website. It's terrywahls.com, TerryWahls.com. And check out her new book, The Wallace Protocol, Cooking for Life, the revolutionary modern paleo plan to treat all chronic autoimmune conditions. So it's not just about MS. MS has been the focus, obviously, for her, but this is a diet that can really help all patients who have autoimmune conditions. I read her first book, the Wallace Protocol. I give this my absolute highest recommendation. There is a ton of great information here, and it's more than just diet. It's about lifestyle. It's about avoiding certain types of exposures and toxins. It's about getting moving. And there's so much, I think, that people can do that they don't even realize and that physicians don't realize. And that's why I think your work is so utterly important. And I think that when we look back 5, 10, 15 years from now, we're going to see you as a revolutionary physician in modern medicine. So, I really, tip my hat to you and the work that you're doing.
Well, thank you very much.
Well, thank you for coming on the show. My name is Dr. Anthony Youn, America's holistic plastic surgeon. We will see you next week with another episode. Thank you. Do you want to look 10 years younger without having surgery? Well, my best-selling book, The Age Fix, will tell you how. I spent the past 17 years learning the secrets to turning back the clock and have written all the best of these secrets in this book. This includes the Age Fix Diet, simple changes to what you eat that can make a huge difference in your appearance. I'll share with you a simple skincare routine to keep aging and wrinkles at bay. And I'll share with you the best secrets to treat every single beauty and aging problem there is, from age spots to wrinkles, saggy skin to bad breath, saddlebags to hair loss. And almost all of these can be effectively treated without surgery. So are you ready to turn back the clock and kick Father Time's backside? If so, check out The Age Fix. Now, if you purchase it on my website, dryoun.com, you'll get over $10 off the cover price, free shipping, and you'll receive several free gifts, including a bonus chapter that you can only get by purchasing the book there. Thank you for making The Age Fix such a huge success.